afternoon. You are watching Eagle News America. I'm Ace Ramirez coming to you from Washington. It's Wednesday, April 21, 2021. We have updates from our correspondents across North and Latin America. May Davila in Ciudad de Panama tells us about a majority of nursing homes in Panama being vaccinated against COVID-19. Thomas Likeness in Edmonton, Alberta.
Canada may get more help from the United States for its vaccination program.
Myla Simbulan in Swarthmore, Pennsylvania.
$12 minimum wage increase with a path to $15 to benefit pandemic frontline workers in Pennsylvania.
May Ann Manzano Guerzon in Sicklerville, New Jersey.
New Jersey food banks to receive $10 million coronavirus relief fund.
In Austin, Texas, we have Jessica Isidro.
City of Austin to convert former hotel into bridge shelter for homeless. Small Business Week offers free online classes and events to Austin area residents.
And in Grand Rapids, Michigan, we have Lou Aquino.
Michigan extends COVID-19 health order, strengthens mask requirement for children, and conducts mobile vaccination services.
Michael Hudson in Seattle reports about a sudden surge of COVID-19 cases in Washington state. Abigail Dumlao in Rochester reports about New York State mandating a $15 a month high-speed internet for low-income families. Plus, for tonight's roundtable, it is National Kindergarten Day. Let's talk about lasting things we learned in preschool. Our coverage begins now. President Joe Biden called on Americans Tuesday to unite after a jury in the Midwestern city of Minneapolis found Derek Chauvin guilty of intentionally suffocating handcuffed George Floyd as he lay defenseless, with the officer's knee pressing on his neck for more than 9 minutes.
This is a time for this country to come together, to unite as Americans. There can never be any safe harbor for hate in America.
Biden called systemic racism a stain on the nation's soul in a televised address to the nation Tuesday.
It was a murder in the full light of day, and it ripped the blinders off for the whole world to see. The systemic racism the Vice President just referred to. The systemic racism is a stain on our nation's soul.
The president called for confronting head-on systemic racism and racial disparities that exist in policing and the country's criminal justice system, but pleaded for protesters to steer clear of violence.
And there are those who will seek to exploit the raw emotions of the moment, agitators and extremists who have no interest in social justice, who seek to carry out violence, destroy property, fan the flames of hate and division, who will do everything in their power to stop this country's march toward racial justice. We can't let them succeed.
A jury deliberated less than 11 hours before finding the 45-year-old Chauvin guilty of all 3 charges against him: second-degree murder, third-degree murder, and manslaughter. Appearing alongside President Biden is Vice President Kamala Harris, speaking of the relief the nation was feeling over justice being served, but acknowledged that the result couldn't take away the pain of Floyd's murder.
Today, we feel a sigh of relief. Still, it cannot take away the pain. A measure of justice isn't the same as equal justice. This verdict brings us a step closer, and the fact is, we still have work to do. We still must reform the system.
Harris vows to work with the president to urge the Senate to pass long overdue legislation on police accountability, saying black men had been treated as less than humans throughout U.S. history.
Here's the truth about racial injustice. It is not just a Black America problem or a people of color problem. It is a problem for every American. It is keeping us from fulfilling the promise of liberty and justice for all. And it is holding our nation back from realizing our full potential.
A day after the guilty verdict for ex-police Derek Chauvin, U.S. Attorney General Merrick B. Garland announces the Justice Department has started a civil investigation to determine whether the Minneapolis Police Department engages in pattern or practice of unconstitutional or unlawful policing. Garland describes the scope of the investigation.
It will include a comprehensive review of the Minneapolis Police Department's policies, training, supervision, and use of force investigations. It will assess the effectiveness of the MPD's current systems of accountability and whether other mechanisms are needed to ensure constitutional and lawful policing.
Garland says the civil investigation is separate from and independent of the criminal investigation on the death of Floyd that the Justice Department has previously announced. According to Garland, the investigation will focus on whether the Minneapolis Police Department engages in a pattern or practice of using excessive force, including during protests. Garland speaks of the department's commitment and the challenges the nation faces when it comes to discrimination and policing.
The challenges we face are deeply woven into our history. They did not arise today or last year. Building trust between community and law enforcement will take time and effort by all of us. But we undertake this task with determination and urgency, knowing that change cannot wait.
Meanwhile, in Nigeria, according to the National Bureau of Statistics, the country's inflation rate hit a 4-year high of more than 18% in March, with food prices up 22.9%. At the popular food markets of Lagos, customers paint a grim picture of soaring prices. Let's take a look.
You come to the market just like the way you saw me pricing things. You no longer get them the same way we used to buy again. Even them themselves, they keep complaining. They buy very cost. You manage for that month. Nothing like savings again, no. You only pray for that money to even reach you that month before another salary will come.
You can imagine the sales of some items, the cost of some items as at 2 weeks ago has increased with like 50% increase. We experience that increase almost every day. For we workers to be able to save is affecting the savings. It's affecting because the income is not really increasing, but the prices of items are increased. So it makes it so difficult for us to cope with the economy.
Africa's largest economy was already struggling with a fall in the price of oil, Nigeria's major export, and a weak local Naira currency before the global pandemic struck. Workers blame poor infrastructure coupled with falling value of the Naira for pushing up prices. For today's COVID-19 numbers, according to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time Wednesday, April 21, the number of cases of COVID-19 reported worldwide is now over 143,082,000. Top 3 on the list of countries with recorded cases: U.S. has over 31.7 million, India 15.6 million, Brazil over 14 million. To date, more than 3,047,000 have succumbed to this virus. The U.S. leads the countries with the most number of COVID-19 related deaths with over 568,000. Brazil is next with more than 378,000, and Mexico more than 213,000. For COVID news, oxygen supplies in Indian hospitals run perilously low Wednesday as COVID-19 deaths surged past 2,000 daily for the first time in one of the world's most brutal ongoing coronavirus waves.
In normal course, we are supplying the 15 to 18 tons for medical, then remaining is industrial supplies. Now what has happened, whatever we are producing, 35 to 40 ton capacity what we are having, totally we are dedicatedly we are serving to the health sector.
We have an oxygen plant which has about 20 kiloliters of oxygen. So ordinarily it would last us for about 6 days to a week. Now it's getting over in 24 to 48 hours. So they are filling it alternate days. Going forward, I don't know how more frequently we'll require. So far we haven't had a problem, but the crisis is there.
First and foremost, where it's we are finding it difficult to give personal care or treatment to affected patients, since we are running out of oxygen. The medicines like remdesivir and a few of the drugs are not available, and oxygen has been the main shortage, and we are finding it difficult to admit serious patients who require ventilator. So most of the patients have been sent back because we don't have enough of these oxygen and the remdesivir drug to treat the patients.
Challenges that we are facing is for the patients who are staying at home, who have been diagnosed positive, and they need oxygen. So we have to move pillar to post to get them. Okay, so that's one challenge. And generally, we are also in the network of other hospitals. So they are also having acute shortage of oxygen, and they are running from pillar to post. But one good thing is the government of India has released new oxygen quota. So under which I think this, whatever shortage or lacuna is there, that should be fulfilled.
India, home to 1.3 billion people, is also struggling with low vaccine supplies and has put the brakes on exports of locally produced AstraZeneca shots as it fights a terrifying COVID-19 wave that has overwhelmed hospitals. There have been hopes that despite its packed cities and poor healthcare, India had managed to dodge largely unscathed a pandemic that has killed more than 3 million people around the world. But recent weeks have seen mass gatherings, including millions attending the Kumbh Mela, religious festival, political rallies, as well as lavish weddings, and a terrifying rise in cases. Nepal's press secretary said Tuesday their former king and queen tested positive on their return after attending the Kumbh Mela. Indian Health Ministry data on Wednesday shows nearly 300,000 new infections in 24 hours, among the world's biggest daily totals, as hospitals around the country reported oxygen shortages. Indian Prime Minister Narendra Modi said in an address to the nation on Tuesday, the second corona wave came like a storm. Rakesh Mishra, the Hyderabad-based director of the Center for Cellular and Molecular Biology, says early indications seem to suggest vaccines will work against the new double mutant COVID-19 variant discovered in India, believed to be a major contributor to the country's current surge in cases. Mishra adds that more substantial evidence should emerge in the coming week or two. Let's take a look.
The fact that this variant is increasing in its proportion, that's what makes it in the category of variant of concern, because this is increasing in its ratio in Maharashtra and in many other places. And therefore, even if it is not more dangerous, if it's not more troublesome in many other ways, it is certainly is better in terms of spreading compared to other variants, and therefore it's of concern because more mutation can build upon this and they can be a problem. So that is why any mutation which is increasing its footprint in the population is considered variant of concern. And given that we are not noticing or we have not come to know yet a large number of reinfections, this also gives us some hope that the vaccine will not be a problem. This variant not be a problem against the vaccine, and people who have been vaccinated or those who have been infected earlier and have acquired immunity probably be protected.
In Panama, almost all residents in assisted living facilities have received the COVID-19 vaccine. In Ciudad de Panama, Eagle News correspondent Nate Davila tells us how this was achieved.
A report from the National Coordination of Elderlies of the Ministerio de Desarrollo Social, or MIDES, shows that more than 95% of the older adult population residing in nursing homes or old age homes have received a double dose of the COVID-19 vaccine. The vaccination day has benefited 1,403 of the 1,477 older people who live in the 78 different facilities that operate nationwide. The program has favored 42 old age homes in Panama Centro, Panama Este, Colon, Chiriquí, San Miguelito, Panama Oeste, Panama Norte, Herrera, Veraguas, Bocas del Toro, Los Santos, and Cocle. MIDES explains that in the coming days, the entire population will be vaccinated as part of the commitment that the national government has to prioritize the most vulnerable populations in the country with the vaccine. MIDES notes there was a group of elderlies who had COVID-19 but are already recovered, the reason why not all of them had been vaccinated. It mentions that until April 12, old age homes have been free of patients with COVID-19, highlighting the hard work of the technical staff who keep supervising and monitoring each home. MIDES, through the coordination and supervision of its technicians, provides continuous monitoring of the cases that have been registered. The national government has applied 513,853 vaccines to priority groups that represent 11% of the population. A total of 275,685 have been applied to women and 236,034 to men. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
Thank you, May. The United States will be extending help to countries in need of COVID-19 vaccine. On that list is our neighbor, Canada. To tell us more, Bureau Chief Thomas Leitness joins us tonight. Thomas.
Thanks, Ace. Well, we got some good news from south of the border today, and a tip of the hat to your president, Joe Biden. Apparently, Biden was on the phone today with our Prime Minister, Justin Trudeau. Among other things, the pair talked about vaccines. Now, afterward, Biden spoke with reporters. He said, well, one of the topics that came up is America's expected surplus of vaccine, and Biden says the U.S. will be helping out other countries whose medicine cabinets are somewhat bare. One of those countries, he says, could be Canada. Now, he was rather folksy in his recollection of the phone call with Trudeau. The two spent about a half hour yakking on the phone. He describes the Canadian Prime Minister, and these are his words. This is how he described Trudeau as a fella who's working really hard to take care of his country and deal with this. Biden says details still have to be worked out, adding the U.S. is not ready to start giving away vaccine right away. Obviously, he wants to make sure you folks are taken care of first. And it's no secret that Trudeau has his eye on a stockpile of AstraZeneca vaccine that's not being used in America. As a matter of fact, I don't think it's even been approved down there yet, but it's a big part of our rollout up here. One thing for certain, we won't turn down any inoculants that the U.S. might be giving away. In Edmonton, Canada, Thomas I. Leitness, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Thomas. I understand truck drivers hauling goods between Canadian province of Manitoba and North Dakota can get immunized in the U.S. Is that true?
Yeah, that deal went into effect. As a matter of fact, today, Ace, truckers crossing the border will get access to either the Pfizer or Moderna shots at no charge at all. Vaccines are being arranged on an appointment basis, and the drivers can book them online. Ace?
That's great news. What's the status of the border now?
Status of the border, closed still to non-essential traffic, another month. Well, till May 21st. You recall it was first closed on March 21st of 2020. So we're coming up on 15 months now. When it was first closed up here, interestingly enough, I think we were more worried about the spread of COVID from the U.S. But, you know, now that your immunization rollout is well underway, infection rates are down, the tables have kind of turned, and you're probably more worried about people from Canada bringing the virus along with them in their luggage or something. You know, we're in that third wave up here. Vaccination progress is lagging far behind the United States. My own opinion, this closure is going to last into the summer, possibly even into the fall, and a lot depends on whether we can tame this third wave up here. Ace?
I agree. Closing the borders, I'm pretty sure this has affected the cost of living up there in Canada.
Well, yeah, and we'll put those numbers into perspective for you. The inflation rate, Ace, doubled in the month of March when you compare it to March of 2020. It's now at 2.2% compared to 1.1% a year earlier. But like I said, let's put this into context. The numbers are not as bad as they seem. You see, a year ago, we were locked down. People weren't spending as much. They weren't borrowing as much. They weren't using as much. Demand for a lot of things dropped, like gasoline. Demand for food dropped. Oh, that didn't mean people weren't eating. They were just eating at home. Restaurants were closed, so those commercial buyers of food just weren't there. Now, in March of this year, we had reopened to a degree. Demand for food went up, and so did prices, especially for eggs and dairy. Egg prices, as a matter of fact, up by 11% in March from a year earlier. Dairy was up by more than 2%. But the biggest increase is gasoline, up 35% from a year earlier. Now, also on the rise, housing prices, growing number of people looking to get out of rentals and condos and into something with more space, single-family homes. But with a limited supply, Ace, you know what happens to the price? It goes up.
It's true.
Yep, that's true. It's been offset somewhat by low mortgage rates up here. I mean, I still see deals up here for 5-year mortgages under 2%, but with inflation going up, those days are numbered as well. Ace?
Well, last question for you before you go.
Sure.
So the stimulus checks, they never help, or you never got any?
Oh, the stimulus checks kept a lot of people going. We had a stimulus check of $2,000 a month if you were laid off from your job because of COVID. Actually, I was on that for several months because my job just kind of evaporated and there was nothing else to go to. And that certainly paid a lot of bills for a lot of people. You weren't going to get rich on it, but, you could meet the basics. The stimulus checks certainly did help. It provided a basic income for people. Like I say, that $2,000 a month that the government was giving kept a lot of people going, paid a lot of bills, and along with deferral of payments that people were able to make with their mortgages and utilities. It kept us going. What's killing us now is this third wave. It's the third set of lockdowns, and sadly, some small businesses just aren't going to survive. Ace?
All we got to do is hang in there. All right, be safe, Tom.
You too.
When we come back, updates from Pennsylvania and New Jersey. This is Eagle News America. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
You are watching Eagle News America. I'm Ace Ramirez in Washington. Pennsylvania is again urging a hike in minimum wage to benefit pandemic frontline workers. In Swarthmore, Bureau Chief Mila Simbulan has the story.
That's right, Ace. Department of Labor and Industry Acting Secretary Jennifer Barrier was joined by Representative Kyle Mullins, Representative Marty Flynn, and Scranton home care worker Dominic Cuttrell to call for an increase to Pennsylvania's minimum wage to $12 per hour with a path to $15 by 2027 to provide a livable wage to frontline workers. working families, and local economies. Here's Secretary Jennifer Barrier. Take a look.
Dominic is one of thousands of Pennsylvanians serving on the front lines of the healthcare industry during the COVID-19 pandemic. These Pennsylvanians continue to keep us and our loved ones safe and healthy, and yet too many of them are paid too little to provide for themselves and their families. That's why we're here today, to call for an increase in Pennsylvania's minimum wage to $12 an hour with a clear pathway to $15 an hour. Every worker in Pennsylvania deserves to earn a living wage, especially those who put themselves in harm's way to protect us. Too many of our healthcare and essential workers are earning poverty wages while putting themselves at risk to keep our society running. These workers are struggling to make ends meet, to keep a roof over the heads of their families, and put food on the table while working hard to keep Pennsylvanians safe and comfortable.
Governor Tom Wolf's proposal to raise the minimum wage will boost incomes for nearly 1.1 million workers and putting $4.4 billion into the pockets of Pennsylvania workers in the first year. Raising the wage to $12 an hour will inject an additional $116 million into Pennsylvania's economy. An increase to $15 will bolster Pennsylvania's economy by $321 million in 2027. According to Representative Marty Flynn, and I quote, increasing the minimum wage to $12 immediately, with a clear pathway to $15 per hour over an extended period of time, will move our children, friends, and neighbors to a more livable minimum wage. It will also help reduce the number of low-income families that rely on government aid. A recent report by the Economic Policy Institute found that increasing the federal minimum wage to $15 per hour and eliminating tip minimum wage by 2025 would free up $13 billion to $30 billion in taxpayer revenue annually. The Commonwealth's outdated minimum wage is $7.25, the lowest allowed by federal law. Every neighboring state of Pennsylvania has a higher minimum wage. There are 8 states on a path to $15, including Florida, a red state. Despite doing the same job, Pennsylvanians are now earning less than half of the workers in the states. Nationally, 8 states are on a path to $15, including our neighboring states of Maryland, New Jersey, and New York. Approximately 42% of the U.S. workforce will have a $15 minimum wage by 2026. 2/3 of Americans support a $15 minimum wage, according to a Pew Research Center survey. Pennsylvania's workers must not be left further behind. Right now, Ace in Swarthmore, it's 46 degrees Fahrenheit or 7 degrees Celsius with clear skies. In Swarthmore, Pennsylvania, Myla Simbula and Eagle News, we live in interesting times. Back to you, Ace.
Thank you, Myla. You mentioned a higher minimum wage will save tax dollars. What does that mean? How does that happen?
So a higher minimum wage also saves tax dollars by reducing costs for state assistance programs, and this will increase tax revenue. There's about nearly 38,000 adults that will leave Medicaid at $12 an hour, and approximately 64,400 adults work their way off the program at $15. Raising the wage will also increase the state tax revenue, providing an additional $160 million at $12 an hour and $320 million at $15 an hour, while it also helps local businesses by injecting more than $4 billion into the state's economy. Ace?
I see. So the tax revenue increases as well. That's right. That makes sense. Well, how does raising the minimum wage help close the gender pay gap?
So raising the minimum wage will improve the economic security of women and is a step toward closing the gender pay gap. Of the 1 million workers getting a boost in income from a $15 minimum wage, 6 in 10 are women. So additionally, 75% of the workers are age 20 or older, and nearly 40% work full-time, which refutes harmful stereotypes by making clear that hundreds of thousands of adults are stuck making poverty wages. Ace?
Well, as a nation, how many states are currently above federal minimum wage?
It's really interesting, Ace. According to the National Conference of State Legislature, or NCSL.org, currently 29 states, and including DC, where you're at, have minimum wages above the federal minimum wage of $7.25 per hour. 5 states have not adopted a state minimum wage, and those are Alabama, Louisiana, Mississippi, South Carolina, and Tennessee. 2 states, Georgia and Wyoming, have a minimum wage below $7.25 per hour. And in all 7 of the states, the federal minimum wage of $7.25 per hour applies. Ace?
I see. Well, thank you so much, Milo Simbulan, Swarthmore, Pennsylvania.
Thanks, Ace.
In New Jersey, food banks are to receive $10 million in aid from the Coronavirus Relief Fund. Which food banks are included? May Ann Manzano-Garzon joins us tonight with the details.
Thank you, Ace. In a report released by the Office of Governor Phil Murphy today, he signed Executive Order A5405, which will direct $10 million from the Coronavirus Relief Fund established under the Federal Coronavirus Aid, Relief, and Economic Security, or CARES Act, to the New Jersey Department of Agriculture. This funding will be distributed to 7 New Jersey food banks in order to continue providing families with food assistance during the pandemic. The funding will be distributed to the following organizations: Community Food Bank of New Jersey, $5.2 million, the Food Bank of South Jersey, $1.5 million, Fulfill Monmouth and Ocean, $1.5 million, Mercer Street Friends Food Bank, $1.1 million, Norwest Cap, $300,000, Southern Regional Food Distribution Center, $300,000, and Farmers Against Hunger, $100,000. Department of Agriculture of New Jersey Secretary Douglas Fisher said that food banks carry out a crucial and valuable role in serving the food insecure for all communities throughout New Jersey. This funding will help ensure access to meals and the necessary assistance for those who may find themselves in need of a helping hand during a time of stress. And as for New Jersey's latest COVID-19 numbers, here is Governor Phil Murphy during his COVID briefing earlier today. Take a look.
We are reporting a total of more than 6.2 million administered doses, and just shy of 2.6 million New Jerseyans are now fully vaccinated. We are also reporting an additional 3,614 positive test results, either PCR or presumed antigen positives. The statewide rate of transmission, Ed, has crept up a hair over the past couple of days, now at 0.93. Let's hope it goes the other direction. The one-day positivity for the 21,242 PCR tests recorded on Saturday was, surprise, surprise, back into low double digits, 10.94%. But as we have noted many times, the weekend percentages usually see a spike as the number of total tests is low. And also our assumption is you're getting tested on a weekend because you've got a cause or a reason to do so. So while we cannot dismiss this, and we won't, it comes with that important caveat. Across our hospital systems, last night's census counted a total of 2,114 patients being treated. Of those, 1,961 were confirmed COVID positive. The other 153 were persons awaiting those test results. Of this group, 455 were in intensive care and 248 were on a ventilator. And throughout the day yesterday, 262 live COVID patients were discharged from our hospitals, while 263 new COVID patients were admitted. And our hospitals, again not confirmed, reported 22 deaths yesterday. And with the heaviest of hearts, we must report an additional 46 newly confirmed COVID-related deaths. The number of probable deaths was also updated today, Ed, by you and your team, and that total is now 2,611.
And Ace, for a quick weather update, it's currently 10:18 in the evening here in New Jersey, and it's partly cloudy. it is 43 degrees Fahrenheit or 6 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to Ace.
Mayanne, so how will the $10 million funding help the recipient organizations?
Well, Ace, the financial impact of the pandemic has affected thousands of families here in New Jersey, making it tragically hard to put food on the table. And with this funding to large food banks, Ace, they will be able to continue to be a lifeline to many families here in New Jersey. They will help address hunger crisis in the state by providing food to the residents in these difficult times. Ace.
Are we expecting a drop of
a drop of all restriction? Well, Ace, according to Governor Phil Murphy, we will continue to open up incrementally. But the numbers, he said, our COVID numbers or our reality does not suggest that we are ready to drop all of our restrictions at the moment. He said that the numbers got better, but still not where we need them to be. Ace.
Thank you so much, Mayanne Manzano Garzon, Sicklerville. Kisses to the little one, okay? Up next, updates from Texas and Michigan. Eagle News America will return shortly.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
You are watching Eagle News America. I'm Ace Ramirez in Washington. Several stories from the Lone Star State tonight. What once was a hotel will be converted into a bridge shelter for the homeless in Austin. This story and more from Eagle News correspondent Jessica Isidro. Jessica.
Thank you, Ace, and howdy from the Lone Star State. Here in Austin, the City Council has made ending homelessness as the top priority for the city. The city is investing in safe, easily converted living spaces like former hotels to help the homeless access the stability and care they need. A former Roadway Inn hotel at 2711 South Interstate 35 is being designated as a temporary bridge shelter for encampment residents under the HEAL program, which stands for the Housing Focused Encampment Assistant Link Initiative. This program is designed to help homeless individuals currently residing in designated encampments to find housing or housing-focused shelters, as well as supportive services. The former hotel was purchased by the city last April with grant funding from the U.S. Department of Housing and Urban Development and is temporarily being used as a protective lodging facility, or ProLodge, for high-risk individuals who need a safe place to practice safe hygiene and social distancing during the COVID-19 emergency response. Renovations are underway for the newly named Southbridge Shelter, which will serve as a bridge shelter for individuals who were already approved for permanent housing intervention but need a place to stay while waiting out any delays. Southbridge will include the following features. Upon entrance, the shelter clients will be immediately connected with caseworkers tasked with linking them to rapid rehousing, which means they would ultimately move on to apartments across the city with rental assistance and ongoing case management. This is an invitation-only shelter and will not be walk-up, avoiding the need for people to congregate outside the property every day to secure a bed or seek other types of services. Clients will be offered rooms to stay in and receive assistance as they progress into permanent housing. Their expected stay at the bridge shelter is temporary, not indefinite. The property will have on-site security, staffed 24 hours a day, and a new fence will be installed. The property has 87 rooms, which each of them having their own bathroom. Some of the rooms will be used as offices and meeting spaces. The capacity of the property is likely to be limited due to COVID-19. For more information, you can find it at austintexas.gov. In other news, Small Business Week is coming, and the City of Austin is offering free virtual business classes and training on May 3rd through 7th, 2021. The city's Economic Development Department will host a series of no-cost online training and events aimed to help local businesses, creatives, and nonprofit organizations. Participants can register for the free sessions and events whose topics include strategic pricing, business taxes, structured development, funding, marketing, and more. Field experts will also be available for one-on-one business coaching. The full schedule can be found at www.smallbizaustin.org. Meanwhile, I hope you're staying safe in your part of the country. In Austin, Texas, I'm Jessica Isidro, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Jessica. Are there a lot of encampment areas there in Austin?
So there are currently 4 sites of encampments in South Central, East, Downtown, and Northwest Austin. But unfortunately, by the end of August, camping will no longer be allowed there. So efforts are being made to try to relocate the residents through this provision as quickly as possible.
I see. Well, at least they're going to let them finish the summer, right? End of August.
Yeah.
The City of Austin is providing free business classes to the public during the Small Business Week. What are some of these classes being offered?
So some of the classes, there's a lot over the course of all 4 days. There's classes like creating an artist business plan, digital psychology, and circular economy business principles. Ace?
Digital psychology, that sounds interesting. Are you planning on taking any of them?
I do want to attend creating an artist business plan, strategic pricing, as well as building a resilient business. I've tried a few times to start my own business, but I haven't had much success getting off the ground. So I figure if I continue to educate myself and gain more knowledge under my belt, I can potentially have more success in the future when I decide to try again. Ace?
All right. Patience is a virtue. All right. Thank you so much, Jessica Isidro, Austin, Texas. Meanwhile, in Michigan, facing an increase in COVID-19 cases, the state is extending its health order and strengthens its mask requirement for kids. This and more from Eagle News correspondent Lou Aquino in Grand Rapids. Lou.
Thank you, Ace. Here in Michigan, the Department of Health and Human Services extended its gatherings and mask epidemic order. The order, which preserves the strongest public health order in the Midwest, is designed to balance day-to-day activities while controlling the spread of COVID-19 and saving Michiganders' lives. It includes expansion of mask requirements to children ages 2 to 4 to further protect the state's residents. Expanding the mask rule to children ages 2 to 4 requires a good faith effort to ensure that these children wear masks while in gatherings at child care facilities or camps. This order takes effect on April 26th and extends through May 24th, 2021. This addresses the increase in cases among younger Michiganders and follows recommendations from the American Academy of Pediatrics and Centers for Disease Control and Prevention guidance. According to Dr. Matthew Hornick, the president of Michigan chapter of the American Academy of Pediatrics, or MIAAP, wearing a mask significantly reduces the spread of infection and should be part of the comprehensive strategy to reduce COVID-19, including for children aged 2 and up. And the use of masks does not restrict oxygen in the lungs, even in children. In addition to the extended gatherings and mask epidemic order, Michigan continues to provide vaccinations to residents and aims to vaccinate 70% of Michiganders. As of today, 29.5% of Michigan residents 16 and older had been fully vaccinated for COVID-19, and 44% had received at least a first dose. To help improve COVID-19 vaccination access for high-risk populations in settings across Michigan, the Michigan Department of Health and Human Services and Department of Technology Management and Budget have issued a request for proposals to conduct mobile vaccination services. One county here in Michigan has actually started to bring vaccines to the homes of residents. Those residents unable to travel to a vaccine clinic or pharmacy in Jackson County can now request an appointment to be vaccinated against COVID-19 from inside of their homes. The service is targeted to homebound individuals and their in-home caregivers, but is available to anybody who would like to receive vaccinations at their home. In Grand Rapids, Michigan, Lou Aquino, Eagle News. We live in interesting times. Back to you, Ace.
Lou, now that everyone above the age of 16 is eligible to receive the vaccine, but you're only 14, right? So have you received your vaccine?
Yes, actually, but I've only received the first dose. I'm actually kind of in a weird situation because I did receive my first dose in Canada when I was there. And I know from Thomas, he used to saying that there's a shortage of vaccine in Canada, so I was not able to get my second dose. So now I'm waiting for my second dose here, and we'll be able to receive mine soon. So,
yeah, I see. Well, what about those children who have a challenging time wearing a mask? What's going to happen to them?
So CDC does recognize that wearing masks may not be possible in every situation, or for some people, for example, it may be challenging for some children with certain disabilities, including cognitive, intellectual, developmental, sensory, and behavioral disorders. So CDC actually provides a guide on their website on what you can do if you or your child cannot wear a mask in certain situations. So you can check out their website for any of those guidance.
I see. All right. Thank you so much. Grand Rapids, Michigan. Up next, updates from Washington State and New York. Eagle News America. We'll be right back.
It's time to take one step further and face the impossible. Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
Look to NHK World Japan for news of the coronavirus outbreak across the globe. You'll find updates and insights in the specialized section of our website. Catch up with programs on your schedule through the free video on-demand service. Learn how to stay in shape and maintain your health deliciously. Ready when you are. NHK World Japan.
Welcome back. This is Eagle News America. Despite administering COVID-19 vaccines to its eligible residents, the Evergreen State reports of a sudden increase in infection cases. In Seattle, Washington, Eagle News correspondent Michael Hudson reports.
Hey, thanks a lot. As of right now, there are currently 390,000 total cases with 5,451 deaths. Recently, there has been a sudden surge of COVID-19 cases in the state of Washington, rising as much as 19.1% in the recent days. Though the state reported giving out 507,122 vaccines this past week, there has still been a steady incline of new cases in various counties. Currently, 3 counties have had to peel back from phase 2 from phase 3 earlier this week. Washington State currently ranks 26 as it pertains to the fastest spread of the virus on a per-person basis. Of the counties with the highest overall per person basis are the Ferry, Cowlitz, and Whitman counties, while King County, which is the largest county in the state, leads the overall new cases. So all we can hope is that people continue to follow the restrictions that are in place within the state as we continue to administer more vaccines and get everyone back to 100%. Reporting from Seattle, I'm Michael Hudson, Eagle News. We live in interesting times. Back to you.
Thank you, Michael. A $15 a month internet service for low-income families program has just been signed into law in New York State. In Rochester, Eagle News correspondent Abigail Dumlao tells us how eligible New Yorkers can avail of this opportunity.
New York Governor Andrew Cuomo signed legislation establishing the first in the nation program to provide affordable internet to qualifying low-income families. This was passed as part of the governor's 2021 State of the State. The legislation requires providers operating in New York State to offer $15 per month high-speed internet to low-income families across the state.
So we're going to sign a law today that is very simple but very profound. All internet providers must offer high-speed internet at an affordable cost, $15 a month, period, all equipment, all fees, etc. That's the cost that they must provide to any low-income family in this state. And low-income are people who qualify for governmental assistance. For America, broadband holds great power. It can either equalize the playing field, where anyone can get access to information and education, or it will divide the society by income, by race, and by class. This low-cost broadband access in this state is the first law of its kind in the nation.
The program is expected to benefit all New Yorkers who have been unable to access the internet and all of the programs available there.
Part of this bill, we're going to do an in-depth study of the places that don't have access to high-speed broadband, identify them specifically, and get them the access.
You know, students are at home trying to learn remotely. There's telehealth issues. People need to have access to good quality internet. And I know that there are some people who literally have to bring their children to libraries in order to do homework.
The pandemic has made it clear that we cannot consider high-speed internet a luxury. It is a necessity for modern life.
Families without the means to afford the reduced cost will be able to receive funding.
For families that can't afford the $15, Connected New York will finance 50,000 students and their families for that $15 a month, so they have access during this period, especially important during this remote learning.
This new affordable internet program will impact nearly 7 million New Yorkers and 2.7 million households. In Rochester, New York, Abigail Dumlao, Eagle News. We live in interesting times. Back to you.
Thank you, Abigail. It's a National Kindergarten Day, and there's this book, All I Really Need to Know I Learned in Kindergarten. It's about insights on things that matter to people wherever they are. Simple things that include saying sorry when you hurt somebody, washing your hands before you eat, flushing the toilet after using, taking a nap in the afternoon, watching out for traffic or looking left or right before you cross the street, cleaning up your own mess, and not hitting people. Tonight, let's ask our team what simple but lasting lessons they learned when they were in kindergarten. Let's start with Jessica. Jessica, kindergarten was just 2 years ago, right?
Sure.
Lasting lesson learned in kindergarten.
How to share toys with my fellow students, and also Look where I'm going when I'm running to line up for recess. When I was in kindergarten, I actually collided with someone, and I had to go to the hospital because my eye swelled up pretty big. So, I learned that. Huh?
You had to go to the hospital because of that?
I did.
That must have been a pretty hard hit.
It was skull that hit my eye. So yeah.
Ooh, no wonder you remember that.
Yeah.
Well, thank you so much for sharing that. Let's go to Myla. Myla, your last.
Yeah. So I had my preschool and kindergarten in the Philippines, and it's huge in the Philippines. Respecting elders is really huge, especially the teachers. Whenever you see a teacher, you should say good morning or good afternoon every time, and you always need to address them with a po at the end. So it's really big. The respect for elders is really huge in the Philippines. So that, yeah,
respecting the elders.
Always in my mind, and so doing this, yes po, ka-ace.
Thank you po. Let's go to Thomas. Thomas, share with us your lasting lessons learned in kindergarten.
You see, I never went to kindergarten. Back when and this is when the dinosaurs roamed the earth. That's when I went to school. I just went into grade 1 at the age of 5. But in grade 1, we sort of, in those days, learned the same thing. A lot of what Milo said. Back in those days, you actually had to respect the teacher. Today, not so much, especially in North America. But in grade 1, it was just all the basics. But there was no kindergarten at that point. This is back in 1956.
See, I'm gonna do the math. 56, 21.
I'll get you a calculator.
Thanks for sharing, Thomas. All right, Lou. Okay, share with us lasting lessons learned in kindergarten.
So for me, one of the lessons that I learned was to correctly spell my full name and to write it neatly. And I remember actually that we had to write our name down on a piece of paper in every single line. But for me, I was kind of lazy when I was in kindergarten, and I thought I would be smart, so I skipped every other line, and I went to the teacher, and I was like, "Oh, I finished the page." But then they had to make me they made me go back and rewrite everything. So that's one of the
that's interesting.
things I learned.
These lessons that we learn from kindergarten, it's interesting. They're actually what we're trying to apply here now in real life. We're applying what we learned in kindergarten. I would share mine. The lasting lesson that I really learned was about brats. Brats are frowned upon. You're a brat, you're gonna take it all the way up to when you grow up, when you're married, or when you're a grandparent. You're still gonna be a brat. But anyway, thank you so much, guys. As always, at the end of every broadcast, we do not forget to recognize the efforts of our healthcare workers, first responders, and essential workers by giving them a round of applause. Thank you for being our modern-day heroes. We appreciate you. That is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.